Dr. Alex Earl. We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. And today we got a special topic that we're going to be talking about, and then of course I'm going to be happy to answer all your questions, okay? And we are live on Instagram, TikTok, and YouTube. Okay, but before we move forward, today we're bringing back that little game where if you watch the live and you get the secret password, okay, and you haven't had surgery yet, then when you book a surgery, you're going to get a great discount on that procedure. But here's the thing, it's a secret password for a secret discount. We're not going to tell you exactly how much it is, but it can be anywhere from $300 to $1,000 off your next procedure, okay? So here are the rules, okay? You have to fill out that virtual consult form today before midnight, okay? And how do you do that? Well, you're gonna go to www.pureplasticsurgery.com and then there's gonna be a little button there that says virtual consultation. You're gonna hit that, you're gonna fill out the form, all right? And when you get contacted, you're gonna tell them the secret password. All right, and the secret password for this live here today, which is November 9th, right? November 9th today? That's right, okay. So jot this down. November 9th, Hump Day secret password is Movember. All right, Movember, because it is Movember. I don't know if you guys notice I got a little extra facial hair here going on. I got the mustache going. And what is Movember? Well, Movember is a month that we talk about, discuss, support men's health issues, and this can be both physical and emotional, okay? And it all started actually with prostate cancer, but it's expanded a little bit more than that. So it's not just about prostate cancer, it's about any kind of men's health issues, and it is kind of very near and dear to my heart. My dad had prostate cancer. Fortunately, he's a survivor, but he went through surgery and chemo and all the treatments in order to do that. So it is something that I bring up every year in November. You'll see me with the nice mustache out here. Okay, so all right, so that's the way it's going to work. So make sure you hit that virtual consultation form. Make sure you have the secret password, and then then you're going to get quite a nice significant discount on your surgery. All right, as long as you book relatively soon, right before the end of the week. Okay, all right. So today, what are we talking about? Today we're going to be talking about the South Beach butt lift, okay? Those of you who have been following me for a little while, I'm sure you guys know what it is. Those of you that have not been following me or are new, you're like probably saying like, the hell is that, all right? So let's get into it, okay? So the South Beach butt lift is our signature butt lift that we have here at Pure Plastic Surgery, and you can only find it at Pure Plastic Surgery, okay? You don't see this anywhere else. It's actually, I should put the little TM here because it is trademarked. It is our own special procedure, okay? So that's right, the South Beach butt lift, and it is different from your typical Brazilian butt lift, all right? So we're not in Brazil anymore. We're here in South Florida. We're in South Beach. All right. So how did this come about? How did I create the South Beach butt lift, or the SoBeBL, and why did I do that? Okay, because there was a problem with the BBL, especially here in South Florida. Okay, and sometimes in Colombia, and sometimes in Dominican Republic. All right, and one issue is that while plastic surgery obviously is a lot more accepted nowadays, and that's great, it's awesome because women should be empowered to do whatever they want with their bodies, there are still a lot of women out there who don't really want it to be so obvious. They don't want to have all this evidence that they had surgery out there, okay? And so a lot of the BBLs that have been coming out in the prior years, they look very surgical, very exaggerated. They had multiple incisions that were very, very visible, and there was a lot of evidence that the patient had surgery, and they didn't want that. They didn't like that, okay? So that was one of the issues there, because nowadays, the style, the way that the butt lift has to be done, should be done in a way where you don't really know if that patient has surgery or not, where it keeps you guessing, especially if you're going to go out, say, in a very tiny two-piece bikini out on South Beach, okay? So that's one of the issues there. The other issue was that a lot of the BBLs that were coming out were very disproportionate, okay? After thousands and thousands of consults, I kept noticing that there's women out there that have, smaller thighs. And you can't do just some cookie cutter butt lift on a patient with a small thigh. It's gonna look disproportionate. Excuse me. It's gonna look like one of those ant booties or diaper booties, okay? And it just kind of gives it away, and it doesn't fit the frame of that patient, okay? So that was another issue there. The other thing that I noticed is that there was a lot of women on the lower BMI side, like BMIs of 21 to 24, and then those were being kind of rejected in terms of the BBL because people are saying that they had too little fat. But that's not necessarily true. Every patient's a little bit different, but they only had too little fat for kind of the classic kind of like Vixen, like very, very big type of look, which is not what we're going for like now. So we have to find a solution for those women that had a BMI in, like, say, the 21 to 24 range, okay? Because they also wanted to have an enhanced shape. They wanted to fill in their hip dips. They didn't want anything that was exaggerated. So we have to find a way to be able to, change the shape for those women as well. And then lastly, of course, the big thing with the BBL, safety, right? So, you hear all the stories out there, everything in the news, all the, the deaths, whether it's here and in other countries with the BBL because of the fat embolism, and that's when the fat gets in the big veins and then travels to the lungs, okay? And so safety is a huge concern, and so how do we make the BBL safer, all right? So these were all the issues that I've been thinking about in order to develop the South Beach butt lift, okay? And of course, what was the inspiration? Well, all the beautiful women that we have here in South Florida, especially, when they want to be out on the beach and not necessarily have like dead giveaways that they're going to, that they've had surgery. Oh, thank you so much. Appreciate that. That's right, okay? So that's the inspiration. This is the problem. So how did we come up with a solution? All right. So we came up with the South Beach butt lift, and it has three very important specific points that make it different than your kind of typical BBL. All right. So number one, we needed to make less incisions and make sure that they were all completely hidden. Okay. So your typical BBL had about, let's see, 3, 4, at least 5 incisions across the back, okay? And now they're all small, but they were a lot more visible locations, okay? And then you have the 2 kind of in the lower kind of butt cheeks for the fat transfer, all right? So we needed to reduce that and make sure they were in very, very well hidden locations. And we was able to do that. So now with the SoBeBL, there's only 2 incisions in the back. One is in between the butt cheeks, so that's very easy to hide. Even in a very small bikini, even in a thong bikini, that one will never be seen, okay? And then the other one is placed right along the bra line, all right? It's placed right around the bra line, and so then that's going to be hidden by, of course, the top part of the bikini. Very, very, easy to hide there. Now, sometimes in kind of a smaller patient, a little bit more petite, it is one more incision we can do. So it'll be 2 to 3. We can do 3 incisions, but instead of having it along the bra line, we can hide it in the armpit area, right in that armpit crease. And therefore, there are no incisions at all across the entire back, which makes it so that there's no evidence that anything was done, okay? In the front, you still have, your 4 incisions, but 3 of them are very, very low in that suprapubic area. Again, easy to hide, and one is tucked inside the belly button, so no one can see that as well. All right, so that's number 1. So we were able to do the same procedure with either the same or better results, with much less incisions in hidden locations. Okay. Number 2 was about the style. Okay, so you want to make sure that you're tailoring this procedure to that patient's unique foundation. Every patient is different. Every patient's thighs have different thickness to them, okay? And so you can't just do a cookie cutter BBL. That's why when you see our BBLs, my BBLs, you'll see that they don't all look like exactly the same. You gotta tailor it to that patient specific foundation, okay? And that's what I like to call an enhanced natural look. Now, whenever I use this term, sometimes I get the question, well, natural to who? It's not about what's natural to me or some like theoretical, like some theory about what beauty looks like or anything like that. That's not what I mean. When I talk about enhanced natural look, it's a look that's catered to that patient's unique foundation, and that's the key there. You gotta change your surgery, how much fat you're gonna put in, where you're gonna put it. It all has to fit that underlying foundation so that everything flows and that all the contours are nice and smooth. And so then that patient, it's not a dead giveaway that they had any sort of surgery done. All right, some people will be like, whoa, like what did she do? Did she like get into a diet and exercise program? She looks fantastic. I'm not sure what she did, but she looks great. And that's what we're going for there, okay? And then of course, the last difference and key step here, which is super important, is that we're doing all the fat transfer under ultrasound guidance, okay? Incredibly important there because that is where the safety comes in, okay? We are turning a blind procedure from one, we're turning the blind procedure into one where you can see, because the ultrasound imaging allows me to see that cannula and I know exactly where it is. I know I'm in that safe space, which is between the muscle and the skin, okay? That's where you want to be. And if you're there, then the chances of a fat embolus are extremely low, essentially almost zero, okay? And that basically takes away that danger, which is what everyone was talking about, okay? So this is very, very key. So South Beach butt lift, only a pure plastic surgery. 3 very, very important differences, which we've outlined here, okay? All right. Now, let me see if I find the room here. So in the back, I wanted to kind of show you guys, and I'm going to try to just kind of draw it here. But this is the back, okay. So the incisions, one is going to be placed right here, okay. That's in between the butt cheeks, very, very low. So even in a small bikini, that's going to be covered up, not going to be visible at all, okay. And then, like I said, depending on the patient, if you're very, very tall or a little bit wide, then it's tough to get it from up here, so we put one right in at the bra line there. But if you have your bikini on, that's not going to be visible. And then if you're a little bit more of a petite patient, then we can hide them right in here in the armpit area, okay? And that's goes right along the crease there. So it's not visible, and the entire back is free from any visible marks, okay? So I hope that makes sense. All right. All right, well, I'm happy to answer any questions regarding the South Beach butt lift, or of course any questions regarding plastic surgery from head to toe.
Okay. A lot in Spanish, but today no es Viernes Social.
Sure, but we can throw it in.
Okay, look at this. What's an alternative solution if you are too old for a tummy tuck, but you want the stomach go?
So that's going to be tough because typically, the main reason why someone needs a tummy tuck, there's two main reasons. One is excess skin, and the other is a weakness of the abdominal wall, all right? Now, if the issue is mostly weakness, then sometimes, working out, doing your core exercises, doing your abs, it can help. But unfortunately, a lot of working out is not going to help the excess skin. So if you're a little bit on the older side and you can't have the surgery done at an outpatient surgery center such as this, then my recommendation is to then find someone that will be able to do the surgery in a hospital setting. Of course, you want to optimize all any potential medical conditions that you may have, so make sure that that's okay, make sure your nutritional status is good, and then have it done in a hospital setting so that all that excess skin can be removed, and then typically it can be observed for 24 hours to make sure everything is good before then you go home.
Can someone with 30 BMI qualify for the South Beach BL? SoBeBL?
Right, so the SoBeBL. So unfortunately, typically for the high, it doesn't work too well for the higher BMI patients, okay? So the BMI for the South Beach butt lift is typically somewhere between 21 to about 25 or so, okay? Because that's the way that we can kind of reach all the areas and remove enough fat with these minimal incisions. Now, that doesn't mean that we can't do something very, very similar, because I think even if we can't do like the less incisions and the hidden incisions, for our higher BMI patients, of course, we definitely still want to do that enhanced natural look. We want to meet their frame, meet their foundation, and of course, all BBL, whether it's BBL or SoBeBL done here at Pure, 100% of them are done with the ultrasound guidance for your safety.
Okay. Can I get the HD BBL or the
Yeah.
SoBeBL after a tummy tuck, and how long after should I wait?
Right, so that's a great question. So you can definitely get SoBeBL after your tummy tuck, and in fact, if you have some loose skin or if you have some weakness or separation of your abdominal wall, your muscles, then I recommend doing the tummy tuck first. So go ahead and do the tummy tuck first, get rid of the excess skin, tighten up those muscles with application, and then you can come back 3 to 4 months later and get your SoBeBL, all right? And yes, at that time, if you wanted to add HD lipo to the SoBeBL, then you can do so. So that is something that we can definitely add to the South Beach butt lift. If you want to do HD, you can add that, okay? And that could be like step number 4 if you wanted to do HD. That's elective, not everybody wants that, but it can certainly be added.
Doug, can you show us where the incisions are done on a higher BMI patient over the same drawing?
Yeah, so typically if the patient is higher BMI, then we of course, those patients tend to be a bit wider, so we have to be able to reach all the areas. So you're still going to have the one that's down here, and you're going to have the one that's on the brow line. But sometimes we have to add one either here, okay, to really kind of bring in, or as a lot of patients say, snatch that waist. Or sometimes we add them kind of up here, in this area here, okay? So if you're a little bit on the higher BMI, then rather than 2 incisions, sometimes it's going to be 3 to 4 incisions in the back. And they're going to be in places that are a little bit tougher to hide. They're still super tiny incisions though.
Do you do Vixen looks?
So I can potentially do a Vixen look as long as it falls within the parameters of what we're allowed to do in Florida, and of course your safety parameters, all right? So Vixen looks back, say, I don't know, 4 or 5 years ago were more popular for multiple reasons. Number one, before, prior to 5 years ago, so anywhere between 10 years ago to 5 years ago, we did understand all the potential dangers of the BBL, and so we were actually advocating to put fat into and deep to the muscle, okay? And so when you had 3 spaces to fill, you had the space beneath the muscle, into the muscle, and above the muscle, you could put in a lot more fat. It wasn't unusual back then to put in like 2,000 cc's per side, okay? And so that way, yes, it would be achieving a more Vixen look in just 1 round, okay? But now, today, we know that that's the wrong thing to do. It is not safe. That's how you can get the fat embolism, okay? So now we only have 1 space to fill, which is the safe space. And the space to fill is the space between the muscle and the skin. And how do you make sure that you're in the safe space? You use the ultrasound. You turn a blind procedure into one where you can see, all right? So now we only have that space to fill, which means that, the skin can expand to a certain degree, but it will eventually get to a point where the skin can't physically expand anymore, okay? And so once you reach that point, that's your rate limiting step. There's just really no way to put any more fat into the area. Even if you try to force it in, as soon as you take the cannula out, it just kind of spits right back at you, okay? So while it's potentially possible to do a Vixen look today, it may take more than 1 round, okay? It may take 2 rounds, potentially 3 rounds, okay? Because we have to keep building upon that safe space, and do not, even if, please, do not go anywhere, do not go to anyone that's putting it intra deep to the muscle, okay? You're risking your life when you do that.
Can you talk a little bit in the differences of recovering between a BBL and a SoBeBL?
Yeah, so in terms of the recovery, it's overall very, very similar. Okay, it's still gonna be 6 weeks where you shouldn't be putting any pressure on the buttock or hips. You're gonna be sleeping mostly face down. And if you are gonna sit during that time, you have to use that BBL pillow, okay? You are definitely gonna need your post-op lymphatic massages, okay? And whether you're doing the BBL, but definitely for the South Beach BBL, you're gonna need at least 20 post-op lymphatic massages to optimize your results, okay?
Okay, Doug, how long after a miscarriage or abortion in early stage would you perform a BBL?
So there's a few things that go into that. So number one, you have to make sure that the abortion was successful in the sense, okay, there's no more remnants left. And so you have to, with the help of your OB-GYN, there's a couple things that need to be done, okay? There needs to be a post-procedure ultrasound to make sure that everything is okay. And then we got to do that blood work, that HCG, to make sure that those levels have come back down to normal. So how long does that all usually take? It takes typically at least 6 weeks. So you'll probably have to wait about at least 6 weeks before then you can proceed.
Okay, how long you should wait after having a first round BBL to get the second round?
Right, so if you're gonna have 2 rounds of basically the same procedure, so 2 round BBL, 2 round lipo 360, you wanna wait a minimum of 9 months, 9-month minimum, okay? Ideally a year, but certainly no less than 9 months. Why is that? Because whenever you do these procedures, you're gonna have a lot of inflammation, a lot of scar tissue, okay? And if you try to go in too soon, it's very, very difficult. It's almost like trying to chisel through concrete, okay? It's also not gonna be very effective because you can't get a lot of fat out, and risk of complications is higher, and the risk for bleeding is higher, okay? So you don't wanna go too soon. So if you had round 1 BBL, wait at least 9 months for round 2. If you can wait 12 months, even better.
Is it possible to fly internationally post-op?
Well, yeah. I mean, we do have our international patients here at Pure. So we've had patients a lot of patients coming from Canada, also from the UK, and we've even had patients coming from Australia and Africa and Ghana. Okay. So is it possible to do? Yes. Now, what are the differences? For the really, really long flights, you want to be able to stay here for a longer period of time, okay? So for our out-of-town patients that are kind of more domestic, they typically have to be here anywhere between 5 to 7 days post-op. Now for the longer flights, like those going back to Africa and Ghana or Australia, we typically ask them to be here for at least 2 weeks post-op.
Okay. Will you do the SoBeBL on someone 20 BMI?
All right, so that we'll have to take that a little bit on a case-by-case basis. I typically say that the lowest range is 21. Now, once you start getting a little bit below that, we have to kind of take a look at you, take a look at your photos, or if you're able to come in person, see how much fat we have left, or how much fat we have, to work with, and then also talk about what are your goals. And if that all kind of comes together, then perhaps we could do it. But it has to, we do have to do an analysis. It has to be on a case-by-case basis there.
Okay, I'm breastfeeding. How long I should wait to get a mommy makeover?
All right. So if you are breastfeeding, the key is that we need 6 months after you stop breastfeeding. Okay. So because the mommy makeover includes the breast surgery, and we don't want to have those ducts open and active when we do the breast surgery. Okay, so once you decide that you stop breastfeeding, from that point, then 6 months, and you can have your mommy makeover.
Does your 360 lipo do legs a little as well, or is that an add-on?
So 360 lipo includes the trunk, what we call the trunk, which is and by that we mean the entire trunk, which means the full abdomen, the full flanks, and the waist, and then pretty much almost the entire back except for the buffalo hump. If you have a buffalo hump, that's additional, okay? So that's what the lipo 360 includes. Now we go to other areas such as the inner or outer thighs, arms, chin. Those are going to be considered additional areas, okay? Now the one area that is included is what we call the suprapubic or mons area. So if you need some lipo to that area, then that's fine. It's part of the lipo 360 as well.
What type of anesthesia is used? Do you have to be intubated?
So I use general anesthesia, and for general anesthesia you do have to be intubated. And I found that it's very, very safe because we have great CRNA providers that have been with us for a long, long time. And 2, it makes the surgery, I think, definitely a lot more efficient and a lot more effective for the patient, okay? When you try to do things under local anesthesia, the patients oftentimes are not very comfortable. and therefore then I'm less aggressive, I can remove less fat, and so then the results I think are not as good. So at least in my hands, it is best to do the surgery under general anesthesia.
Okay, this is a very common question and says, how soon after a BBL can you have sex? And don't judge me.
That's right. And I'm glad you asked the question because a lot of patients are scared to ask. Okay, but it's actually on everybody's mind. It's a very, very common question. And so sex, just like other kind of strenuous activities, we want to wait at least 6 weeks. Okay, I know everyone's like, what, 6 weeks? But yeah, it's true. So you want to wait at least 6 weeks before sex or going to the gym or any sort of strenuous activity or heavy lifting.
Is front armpit bra fat included in the 360 lipo?
So it's not included, but it's certainly an area that we can add on, and we do add that on very, very often because that area is super annoying. It bulges out, from like tank tops and things like that. And it's extremely difficult to get rid of with like diet or exercise. I've seen women that are super thin, BMIs less than 20, and they have that excess fat there. So the only way to get rid of it is via liposuction.
How long does the BBL procedure take with guide ultrasound?
So I would say that my average time is somewhere, depending on how big the patient is, if there are other add-ons, somewhere between an hour and a half to 2 hours. Probably the average maybe around 2 hours. And then, like I said, all depends on the BMI of the patient. If we're adding on several areas, if we're adding on body type, the more areas we do, if we add body type, it's going to be a little bit longer. But average is about 2 hours.
Okay, Doc, do you recommend us to use lipofoams and ab boards after the 6 weeks?
After 6 weeks, no, that's when you can stop. So before 6 weeks, you definitely want to use your foams. I think the foams are the most important. That's what goes against the skin. Typically, we use at least 3 foams, 1 in the front, 2 on the sides, and then you do have your triangle for the back. And those you're going to wear essentially night and day for the first 6 weeks. Now, after 6 weeks, then you're going to scale down on the FAHA to 12 hours a day, and you don't have to use the foams and the boards anymore.
Will a BBL help with cellulite or make it worse?
Right. So that's a great question, and for most patients, the cellulite is going to remain similar. Okay. So remember, BBL is not a cure for cellulite. Not a cure for cellulite. So what do we do for cellulite? We do things such as Quo, which is what we have here, Pure, or Sulfina is another solution. All right. So for most patients, the cellulite remains very, very similar. Now, I have seen a few patients where it does get better because we'll be able to kind of fill in that skin, because cellulite has to do with attachments, but it also has to do with loose loose skin. So I have seen a few patients where it does get better, and I've seen not very many, but I've seen a few, like a couple patients where it got worse. Okay, but that's really not the norm. For most patients, it looks very, very similar. Some patients it gets better, and then a very, very small percentage where I've seen it get worse.
Can you do BBL and arm lipo at the same time?
So definitely, yeah. Arm lipo is something that's very, very commonly added to the BBL. Other areas that are common are chin lipo and inner thigh lipo.
Okay. Does the SoBeBL take less time than the regular BBL?
If we're doing just a straight up SoBeBL, meaning no added areas, no high definition, then typically, yeah, those are a little bit on the shorter side because, like I said, it's usually the lower BMI patients, and so you can do a SoBeBL in an hour and a half. So yeah, but now if you start adding things like high definition, start adding other areas such as chin, arms, thighs, then it can go a little bit longer.
Okay, and the last one, Doc.
All right.
Are drains always necessary in all of your BBL cases?
So they're not completely, I'm not going to say they're absolutely necessary. Now, I like them. I use drains, and I would say probably over 95% of our patients have the drain. And why do I like them? Because, after the first 24 hours, it kind of, all that leaking, all that draining fluid becomes a lot more controlled, and it comes out of that little tube. And also when the massage therapist is doing their initial massages, they can try to push that fluid all out, you know, so that it can exit out the drain. Okay. Now, is it absolutely necessary? No. So that's different than, say, for example, the tummy tuck. So for me, drains for tummy tucks are 100% necessary. Now for the Lipo 360 or the BBL, it's not absolutely necessary. If somebody's completely against the drain, then we can do it without the drain. And what we'll do is that we'll leave the little, you know, the little sites where we do the liposuction. We'll leave those sites open so that then the massage therapist can kind of try to drain through there as much as possible in those first, you know, 5 massages or so. Okay. All right, everybody. Well, I hope you enjoyed the presentation today, and we learned a lot. We talked about the South Beach butt lift. You know what would be really, really cool if you guys want to learn a little bit more about that? Just go to Google South Beach butt lift. All right, you can Google South Beach butt lift. You'll see you know, more information. You'll see a bunch of articles on it. There's even an article in the New York Post on our signature South Beach butt lift that we have here, which you'll see on page 1 there on Google. Okay, but another reminder, so if you want to go ahead and, you know, and you're interested in the surgery, go to our website, www.periplasticsurgery.com, go to the virtual consult and jot this down, okay? The live on November 9th, secret password, Movember, all right? You tell, once they contact you, you tell them the secret password, you're gonna get lots of money off your procedure, anywhere from, it's going to be a surprise, all right? Every week's going to be a little bit different, but it can be anywhere from $300 to $1,000 off, all right? So make sure you jot that down, okay? All right, well, look forward to seeing everybody next week on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.